Hello, everybody. I'm Caleb Williams, and I'm currently a senior at Idaho State University. I'm working on my bachelor's degree in exercise science. And today I'm excited to share my poster that's titled Autism Spectrum Disorder and Adaptive Physical Education. A little bit about me. I plan on going into the education program, specifically physical education, and that's why I wanted to do some research about what adaptive physical education is and how we can use this to help kids that are diagnosed with autism spectrum disorder and help them. So first of all, autism spectrum disorder is a developmental disability that causes social, communication, and behavioral challenges. Through various research, it has been shown that overweight, obesity, and inactivity occur at a higher rate in youth diagnosed with autism spectrum disorder as compared to the general population. And this is due to the symptoms that come with that disease. This is why schools are starting to implement adaptive physical education programs or physical education that has been modified to help meet the needs of youth with autism. For my literature review, adaptive physical education programs have been proven to be highly effective in helping kids diagnosed with autism. Discussed on my poster, we'll be talking about the benefits that adaptive physical education programs have with these kids with autism, the biggest barriers that come with adaptive physical education programs, and then the components of an effective adaptive physical education program. So first of all, a couple of the benefits that come is that it helps prevent obesity. It reduces the risk of heart disease, diabetes, and other common illnesses. And this is due to kids with autism generally have less physical activity than other kids, so they're more prone to getting these diseases. It also improves cognitive and emotional functioning. It decreases negative self-stimulating behaviors. It can also help decrease aggressive behavior and promote self-esteem. And last of all, it can increase happiness and lead to positive social outcomes, which are sometimes what kids with autism have trouble finding. Moving on, the biggest barriers that come with putting in adaptive physical education programs is that kids diagnosed with autism often have poor delayed motor skills such as hand-eye coordination, perceptual difficulties, and difficulties with balance. They often have weakness in posture and movement and strength. Because of the disease, they often deal with problems with sensory stimulation and often have high social anxiety. And then in some cases, severe autism or intellectual disability can be some of the greatest barriers to actually participating in physical education. And then some of the components to help combat that, to have an effective adaptive physical education program, is putting in the sensory integration awareness, which deals with that sensory stimulation and helps the kids diagnosed with autism stay focused on the task or the activities that are going on. It's important that they have great communication and that they can properly communicate with these kids and help them out. It needs to have the proper physical activity for sensory motor skills to help develop and combat these barriers and weaknesses that these kids have. It is important to have good behavioral management and have inclusion for all of the kids, if it's one-on-one or have a whole class. And in conclusion, physical education and activity has been a huge area of deficit in today's youth, and it can be even more of a struggle for kids that are diagnosed with autism spectrum disorder. Although physical education can be a great challenge due to social and environmental factors, adaptive physical education programs have been shown to be a great benefit for these kids. For these reasons, it is extremely important that schools and physical educators are up to date on what these adaptive physical education programs are and start implementing these programs to help them. Thanks for listening about my poster, and if you guys have any questions, I'd be happy to answer them.